Hey there, viewers! Pregnancy is a time filled with joy and excitement, and the majority of pregnancies progress without any issues. But the reality is that every pregnancy poses some risk. One potential life-threatening complication is called preeclampsia, and it's more common than you think. If left untreated, it can be fatal to both you and your baby. So keep watching to learn how to recognize some of the warning signs of preeclampsia, and make sure to stay until the end to learn the 3 things you can do to lower your risk of developing preeclampsia. Real quick, don't forget to like, subscribe, and comment below. Why is preeclampsia so dangerous? When you have preeclampsia, your elevated blood pressure puts stress on your organs and can reduce the blood supply to your placenta. This pressure also causes injury to your liver, kidneys, and lungs. If untreated, preeclampsia can progress to eclampsia, and the high blood pressure can result in seizures. Preeclampsia can also cause preterm delivery, which can lead to health issues for your baby, such as low birth weight and trouble breathing. Ultimately, severe preeclampsia can lead to death in both the mother and the baby. Preeclampsia usually starts after 20 weeks of pregnancy, but in some cases, it can start earlier. It's characterized by high blood pressure, swelling in the hands and face, and protein in the urine. Not all women will have all of these symptoms, which can sometimes make it difficult to diagnose. In addition to these classic signs and symptoms, other potential symptoms include headache, shortness of breath, blurry vision or dark spots in the vision, and pain in the right upper quadrant of the abdomen, near the liver. Many people are unaware that they have preeclampsia until they have their blood pressure and urine checked by their doctor. So if you develop any new symptoms during pregnancy, it's important to share them with your provider, as they could indicate a severe medical condition. Some people have an increased risk of developing preeclampsia. Risk factors include expecting multiples, a personal medical history of high blood pressure, kidney disease, or diabetes, obesity, autoimmune conditions such as lupus, and a family history of preeclampsia. No one really knows what causes preeclampsia, but it's thought to be due to an issue with blood flow to the placenta, which is an organ that develops during pregnancy and is responsible for providing nutrients to the baby. The treatment of preeclampsia depends on how far along you are in your pregnancy. If it develops early in the pregnancy, you will likely be closely monitored by your healthcare provider with frequent prenatal visits and tests including urine samples, blood draws, and ultrasounds. You will also need to check your blood pressure at home to monitor it between appointments. If you develop preeclampsia close to the end of your pregnancy, you will likely need to deliver your baby early. Sometimes it's safer to deliver the baby early rather than to risk prolonging the pregnancy by waiting until you go into labor. The only cure for preeclampsia is to deliver the baby. There's a chance you'll be able to have a vaginal delivery, but sometimes providers will recommend a cesarean section, also known as a C-section, for safety. Once you deliver, your healthcare provider will monitor you for several weeks to make sure that your symptoms have resolved. So, what can you do to improve your health and reduce your risk of developing preeclampsia? 1. If you already had high blood pressure or diabetes prior to pregnancy, talk to your doctor about what you can take to control your blood pressure and to control your diabetes. Make sure to eat food that is low in salt, because a high salt diet can increase your blood pressure. 2. Try to stay active during pregnancy and make sure to get plenty of sleep. Regular exercise and a good night's sleep have been shown to reduce blood pressure, so do your best to prioritize activity and sleep during pregnancy. And finally, your doctor may have you start taking a low-dose baby aspirin, which has been shown to reduce the risk of developing preeclampsia. When treated, most pregnant women with preeclampsia go on to have healthy babies. This is why it's so important to communicate with your provider if you develop any new symptoms during pregnancy. Make sure to attend all of your prenatal visits and call your provider if you have any concerns. Remember, even if the office is closed, there should always be an off-hours provider on call. Don't hesitate to reach out, even if it's after office hours. Was your pregnancy complicated by preeclampsia? How did it affect your birthing experience? Share your story with us in the comments below. If you liked this video, give it a thumbs up. To learn more interesting facts about the human body, subscribe to the channel. Here are 2 more videos that you should check out to learn more about your health.